My name is Paige Young, and today I'll be talking about the COVID-19 virus. COVID-19 virus is a virus that can cause severe respiratory syndrome. Signs and symptoms of the COVID virus are fever, cough, shortness of breath, fatigue, headache, sore throat, loss of taste and smell, congestion, nausea, vomiting, diarrhea. You want to seek medical attention right away if you have any of the following symptoms: difficulty breathing, chest pain, inability to wake, or confusion. Now, when you call 911, if you have to for somebody, just make sure you tell the emergency workers that you suspect a person might have COVID-19. That way, the medical staff can have their proper protective equipment on. COVID-19 is spread from infected persons through droplets, talking, sneezing, coughing, singing, and it can enter through your eyes, nose, and mouth. And to prevent it, contracting the COVID virus, you want to wear a mask, stay 6 feet apart. If you're not related or live in the same household, wash your hands, keep surfaces clean, avoid touching your eyes, nose, and mouth, and get the vaccine when it's your turn. Over here, I have products to tell you about for preventing the COVID-19 virus. The first one is the mask. You want to wear the mask properly. You want to cover your nose and mouth. I see a lot of people doing this. I mean, it's not really protecting you from anything. So just make sure you have your mask on properly. It's covering your nose and mouth. Also, we have hand sanitizer. When you can't wash your hands, this is good for convenience. At least you're protecting yourself. I mean, it's recommended to wash your hands, but when you use hand sanitizer, the CDC's is the Center for Disease and Control and Prevention, says you want to make sure you have enough hand sanitizer to do the palm side of your hands and the outside of your hands and in between your fingers, and give it a nice rub. Now, when you wash your hands with soap and water, which is preferred, I know in the medical field where I work at, if your hands are soiled, you're supposed to wash your hands. It's recommended anyway. Alcohol-based hand sanitizers are for your hands are unsoiled. So when they recommend you washing your hands, they want you to wash them for 20 seconds. That means soap, water, scrub for 20 seconds. And you just lather it up in between your fingers, underneath your fingernails, the palm side of your hands, the outside of your hands for 20 seconds. I'm running the clock right here. We're still at 13, 15. You just keep scrubbing. We're at 18, 19, and 20. So that's how long you need to scrub your hands to do it effectively. Right here is for your surfaces. This right here, the directions on this one is you want to make sure that the surface gets wet, and then use enough wipes where the surface is wet, then you let it air dry for 15 seconds. Now on the back of these products, it should tell you how long, anytime you get wipes, how to use them and how long they need to dry, and how to use them to be to actually work, like make sure the surface is actually wet. Now, with the 6 feet apart, I've heard that you could use 2 arm lengths apart instead of 6 feet apart. Of course, if your hands are not clean, never touch your eyes, nose, and mouth, because that's how it's contracted. So, now right now, you can get vaccinated if you're a healthcare worker, or if you're 65 and older, or you're an essential employee like working at grocery stores and stuff like that. You can go to your local pharmacy and get the vaccine. You can go through your healthcare provider, or you can go through the state clinic. The population that I'm covering for the COVID-19 virus is the senior citizens, age, sometimes you hear it 60 plus, and sometimes you hear it 65 plus. So that's the age group that I'm covering today. The CDC says that this age group is twice as likely to suffer a serious illness than a younger people. They recommend that age 65 and older, if they have underlying issues, they should shelter in place. Now, underlying issue, they say, are cancer, chronic kidney disease, COPD, Down syndrome, heart disease, organ transplant, obesity, diabetes, if you're pregnant, if you have sickle cell anemia, and smoking. They say you should just shelter in place because you're at high risk of contracting and getting seriously sick from the COVID-19 virus. Some barriers that I found with the 65 and older population is the use of technology. A lot of things are online now, like everything I'm telling you about with the CDC, all that information I got online. Delaware.gov, which tells you about vaccines. Delaware mandates is all on Delaware.gov. So to get our elderly population or senior citizens more up to date on technology, there's a site called Oasis Connections, which will teach older citizens how to use technology, and also they can learn from their friends and family members. Another good thing about telehealth is if you use telehealth, then you can they can see their doctors too without having to go in and risk contracting the COVID-19 virus. Telehealth is also covered under Medicaid right now too. So, well, they're Medicare, so it's covered. Medicaid, Medicare, they're both covered right now under telehealth to help prevent the spread of COVID-19. It's safer. They can just see their doctor via Skype or Zoom or whatever application they use to see their doctor. Another problem that they're having right now, the senior citizen population, is a lot of families out there now are losing their jobs. Unemployment is up drastically. So families that were paying for their elderly or senior citizen family members to get care from other people, as far as like housekeeping or even medical people to help them, they can't afford it anymore. So, but good assistant programs, if the family needs any kind of assistance and resources, is I put up here, need help, is dial 211. You literally just pick up your phone, you dial 211. This is a great resource to find mental health help, food, if you need food, medical help, housing, or transportation. It's a great resource. Age 65 plus are at risk for anxiety and depression due to isolating. They have the underlying disease. Like I said, they want them to stay at home so that way they don't contract COVID and get seriously sick from it. So these people are suffering more from anxiety, depression. Like I said earlier, if we can teach this population how to use technology better, the ones that don't, they can Skype and Zoom with their family members. And that way they won't feel so lonely. And also they can reach out to their family members via phone calls, Also, this population needs to limit how much they watch the news. Studies are showing that older population, senior citizens that constantly watch the news is giving them more anxiety and depression. They need to limit how much they watch the news to a half hour in the morning, a half hour at night. That way, we can keep their anxiety down about the COVID-19 virus. Resources like I've talked about is the CDC, the Center of Disease Control and Prevention. You can find that online. Delaware.gov, which will tell us about what's going on locally with Delaware, our mandates, and when the vaccines are available, what to do to avoid COVID, the signs and symptoms to look for. It also has Delaware 211 on there. So, like I said earlier, Delaware 211 is a great resource. But there's also for food, there's Meals on Wheels. For bills and to get help financially, they have a website called benefitscheckup.org that can help to see if this senior citizen population can utilize any resources out there to help the bills. There's Medicare if they need help with insurance. They can go to medicare.gov. Transportation, there's eldercare.acl.gov that will help with transportation. Distress, like I said earlier, with the senior citizen population, elderly population feeling more depressed and anxious, you can call 211, which has mental health resources, and there's also a disaster distress helpline which they can call, which is 1-800-985-5990, which can help them. They can talk to somebody about their anxiety and depression that they're having so they don't feel so alone. So thank you for your time, and I hope you learned something about the COVID-19 viruses and the resources that are out there to help you and your family.